Hello and welcome to the City of Midland 2021 Open Enrollment presentation. Open enrollment starts October 19th and will be available through November 13th. There will not be an increase in medical, dental, or vision premiums, and no changes have been made to the current plans. The available amount for flex spending account maximum has remained at $2,750 for medical, and dependent care remains at $5,000, limit that was set by the IRS. Due to ever-changing COVID situation, if you and or your spouse completed a PHA last year, which is known as a personnel health assessment, you do not need to complete one this year. If you or your spouse are new enrollees on the plan, you are eligible for the incentive. Please visit the Human Resources Office to pick up a form required for the clinic. Remember, if you are married and your spouse is on the plan, you both must complete the PHA to get the incentive. Enrollment is passive this year. If you are not making changes to medical, dental, or vision, you do not have to go into the system at all. Everything will roll over. However, you must re-enroll in the flex spending, either medical or dependent care. We will go through how to do that later in the presentation. Again, there are no plan changes this year, but we will explain the major highlights of each plan in the next couple of slides and then cover costs. Other than premiums, the only differences in Plan A and Plan B are in the deductible amounts. Plan A has a $1,500 individual deductible and a $3,000 family deductible. Once the deductible is met, everything in-network is paid at 80% by the plan and 20% by the member, up to a $5,500 out-of-pocket maximum per individual, or $11,000 per family. All wellness checks are covered at 100%. Each member has a separate $100 prescription deductible. Prescription prices are as follows. All generic medicines are no cost to members, and members pay 30% for the cost of retail brand drugs for a 30-day supply. But if you get a 90-day supply, you pay $90 after deductible. The out-of-pocket maximum on this plan includes all in-network medical and all pharmacy copays or coinsurance. Once a member reaches $5,500 or a family reaches $11,000, you have no more out-of-pocket costs for the year for in-network expenses. Please remember that out-of-network charges do not apply to the deductible amount or the out-of-pocket maximum. Out-of-network charges you pay at 50% for reasonable and customary. Again, the main difference between Plan A and Plan B is the deductible amount. All other coverages, prescriptions, wellness, and out-of-pockets are all identical between both plans. There is no deductible in Plan B. You immediately pay 30% of all eligible charges and the plan pays 70%. In Plan A, you pay the first $1,500 and then the plan pays 80% and you pay 20%. As we said earlier, the premiums have not changed. The following premiums are with the PHA incentive. If you choose Plan A, the employee coverage is only $10 per month. Employee plus spouse is $100 per month. Employee plus child is $50 per month. And family coverage is $275 per month. The premiums for Plan B are employee-only coverage, $117 a month. Employee plus spouse is $284 per month. Employee plus child is $202 per month. And family coverage is $512 per month. The premiums without completing the PHA have not changed either. The rates for this on Plan A includes employee only at $35 per month, employee plus spouse at $150 per month, employee plus child is $75 per month, and family coverage is $325 per month. The premiums for Plan B are employee only at $142 per month, employee plus spouse at $334 per month, employee plus child is $227 per month, and family coverage is $562 per month. The 2021 dental benefits also have no changes this year. The dental benefits include a calendar year maximum of $1,500. Orthodontia lifetime maximum is $1,000. The deductible for basic and major services is $50, and the orthodontia deductible is also $50. Preventative care is covered at 100% and includes 2 cleanings per year. The dental plan covers 80% of costs for basic dental after the deductible, and major dental is covered at 50% after the deductible. There are no changes in dental rates this year. Premiums for dental insurance include employee only at $17.50 per month. Employee spouse is $35.50 per month. Employee plus child is $37 per month. And family coverage is $53.50 per month. Like the other insurance options, the vision benefits have remained the same this year as well. The vision plan has an annual maximum of $400 for any combination of frames and lenses. The benefit for vision exams is an $85 annual maximum. The plan covers frames, lenses, and the exam. There is not a specific provider network, and a separate vision card is not issued. The medical card is all that is needed for benefit verification and claim submission. All information for claims can be filed with Allegiance. The mailing information for these claims can be found on this slide, as well as on your ID card. There's no change to the vision premium rates. The rates are employee only at $13.14 per month, and family coverage is $39.40 per month. As a reminder, we offer a free confidential counseling service for all employees and their dependents through Deer Oaks EAP. You do not have to be on an insurance plan to take advantage of this service. All you do is call the toll-free number and tell them that you work for or you are a dependent of someone who works for the City of Midland. Employees and dependents will receive up to 6 free visits with a licensed mental health counselor per incident. The EAP also offers limited legal and financial services and elder care or child care services. If you have previously been enrolled in a flexible spending account, or if you want to enroll in other unreimbursed medical or dependent care, you must do it during this open enrollment period. These enrollments do not roll over. The election must be done every year. This is the IRS regulation. The annual maximums you may elect are $2,750 for medical and $5,000 for dependent care. You may carry over up to $550, which was previously only $500, in unused medical funds every year. You must make a flex election by logging into the enrollment system reimbursement accounts link and completing the 2021 election. We will walk you through this later in the presentation. We offer all employees and dependents who are covered under a medical plan a telemedicine option through Wellvia. This is great for most urgent care and acute care issues 24 hours a day, 7 days a week, 365 days a year. These services are offered at no cost to anyone. We recommend you download the app or go online to create your account today, so when you need the service, the process for speaking to a professional is faster. The use of telemedicine can save you money and time by avoiding copays and long waits in the doctor's office. The service is available most anywhere in the country, so even while traveling, you can reach a qualified physician to help you with common conditions. Information for Wellvia can be found on your medical ID card. Please note, prescriptions will be called into the pharmacy of your choice according to your location at the time of the visit. Whether you're new to the city coverage plan or just looking for a new or different provider, Allegiance has made the search simple. To find an in-network provider, go to www.askallegiance.com/Midland. Select Find Provider, then select Cigna in-network. Then you will pick Cigna Open Access Plus Network and choose the provider type, which can be primary care, pediatrician, OBGYN, or etc. Here are a few important dates to note. Open enrollment begins October 19th and continues through November 13th. Flu shots can be obtained at the Health and Wellness Center beginning Monday, October 26th by appointment. Employees and their dependents who are covered under the City of Midland insurance will receive the flu shot at no cost. Tammy and others from HR will be at the ATC building located at 3200 West Colbert, room 137 on Wednesday, November 11th from 8 a.m. to 6 p.m. to assist those who need to make changes to either their health coverage or flex spending. COVID limits this opportunity to 20 employees at a time in the classroom, and everyone must maintain 6 feet social distancing protocol. Therefore, there may be a wait to be assisted. If you have benefit questions or enrollment questions, you may contact Tammy Bellman, the benefits coordinator, at the email and phone number listed on your screen. This contact information may be used anytime during the year if you have questions pertaining to your benefits. The next section we will be covering is regarding Allegiance, our insurance provider. The most important thing to remember about your ID cards is to make sure providers verify eligibility with Allegiance, not Cigna. Providers may call the Allegiance customer service line at 800-877-1122, or they may use the 24-hour verification of coverage fax back number at 406-523-3199. This information is available to the provider on your ID card. Allegiance Case Management is available to assist members who may have a complex medical diagnosis, for example, cancer, premature babies, diabetes, surgery recovery, or etc. Full-time registered nurses are available to help you navigate your healthcare issues and answer your questions. Once an established case has been made, the case manager will regularly contact you by phone and provide written information regarding your case upon request. To learn more about case management, contact Allegiance at 1-877-792-7827. Allegiance has created a dedicated website for all City of Midland employees to help with any questions you may have. The website is www.askallegiance.com/Midland. Employees can access practically everything needed in regard to benefits from this website, including benefits, rates, find a provider, submit claims, FAQs, and etc. So, how do you enroll and make changes for the upcoming year? If you click on the link on the top right of the www.askallegiance.com/Midland webpage, it brings you to a page that looks like this. You will type your username and password and select Login. If you have never logged into the Allegiance site, you will need to click Register a New User and proceed through the steps to set up your account. If you don't remember your username or password, you can use the Forgot username and password links at the bottom of the page. After you log in, this should be the next page you see. In order to make medical, dental, or vision enrollment changes, click on the health account link shown here with a yellow arrow. The next page will bring you to the enrollment screen. Select Enrollment, and then on the drop-down menu, select Enrollment Wizard. The next screen will show you your current enrollments. You may make changes to your plans from this page. Once you have made those changes, or if you are not making any changes, click Submit. Once you have completed the health accounts portion, you will need to close the window you completed the health accounts in. If you want to elect the flex spending benefit, you will need to return to www.askallegiance.com/Midland and log back in. Remember, you must do your flex enrollment every year. This benefit does not roll over. After you've completed your medical enrollment, or if you just want to do the flex only, from the main screen, click the link on the reimbursement account as shown on this slide by the yellow arrow. On the next page, click either one of the Enroll Now buttons. On the next page, click the link titled Begin Your Enrollment Now. That brings you to the next page where you can verify or enter your information. Once completed, click Continue. On the next page, you must confirm you understand the rules of both accounts available. Put a check in each both and then click Continue. On this page, you will enter how much you want to have taken out of your check pre-tax. FYI, the numbers you enter at the top of the page is an annual amount. Below it will calculate your monthly deduction amount. Click Continue. This page allows you to choose how you want your money sent to you, either via a paper check or a direct deposit, should you request a reimbursement. After you make your selection, click Continue. This last page is your Flex Enrollment confirmation page. If you want a copy for your records, you can print this page. Once you have verified everything, click Submit at the bottom of the page. If you do not click Submit, your FSA enrollment will not be processed. This final slide contains some of the important contact information you will need throughout the year. Feel free to screenshot this slide to save for future reference. You can always contact Tammy Bellman, the Benefits Coordinator, at 432-685-7416 or tbellman@midlandtexas.gov at any time with questions about enrollment or claim submission assistance during the year.